On Wednesday, President Obama addressed the nation on the need to overhaul the country's healthcare system. It was a critical speech for the president, whose campaign stressed healthcare reform. But in recent months, the debate has spiraled into a nasty bipartisan battle. President Obama made a calculated move to take back control of the issue. Here's an excerpt from his speech.
We are the only democracy, the only advanced democracy on earth, the only wealthy nation that allows such hardship for millions of its people. There are now more than 30 million American citizens who cannot get coverage. In just a 2-year period, 1 in every 3 Americans goes without health care coverage at some point. And every day, 14,000 Americans lose their coverage. In other words, it can happen to anyone. But the problem that plagues the healthcare system is not just a problem for the uninsured. Those who do have insurance have never had less security and stability than they do today. More and more Americans worry that if you move, lose your job, or change your job, you'll lose your health insurance too. More and more Americans pay their premiums only to discover that their insurance company has dropped their coverage when they get sick or won't pay the full cost of care. It happens every day.
Joining me now to talk about the importance of the president's speech is John Warren, editor of San Diego Voice and Viewpoint, and David Ogle, education editor for the San Diego Union Tribune. Welcome to you both, and I'll start with you, John. Did President Obama adequately make his case for why the nation needs health care reform?
I think he did an outstanding job of making the case, and I think the part of the clip that we just saw was very important, because with this period of economic downturn, we have people losing jobs and we have people losing health care, and the figures that we get in terms of 47 million Americans being without health care obviously are not current or up to date based on this 14,000 people a day. What we need to understand here is that the arguments that we're getting now in terms of the fight against certain provisions of health care are not coming from those who are uninsured. Those arguments are coming from the people who stand to have the world as they know it: insurance companies, people with private plans, pharmaceuticals, doctors. Their worlds will change in terms of the profitability of the healthcare industry. And so that is what this argument is all about.
But David, I would think the president needs to appeal to both ends of the spectrum if he's going to get some kind of bipartisan support on this. I mean, did he say anything that might lessen the concerns of, let's say, the insurance industry?
Well, I think he did. He made clear that he was willing to listen to other ideas for the first time, really giving some concrete specifics of what he wanted to do. He borrowed some ideas from the Republican Party, including John McCain. But he wasn't really appealing to the ideologues on the right wing, where he made very clear in his speech that, you know, he's not going to go there. But he did get some movement from the center, from the Olympia Snows and Susan Collinses of the world, and he also got some movement from the left wing of his party.
So moderate Republicans, the Olympia Snows and that group, and the left wing of his party. But you're talking about the left wing of the Democratic Party. But,
yes.
But John, could they really be happy with the fact that single payer is off the table and that the public option seems to be, if it's there, it's very mild?
Well, they don't consider the public option off the table. I mean, Nancy Pelosi made it very clear last week that that had to be a factor. The president indicated that public option was there, but he didn't nail himself down to what form it might take. He felt that there were certain places where people had many choices in terms of insurance. Then there were other places where there were no choices. And so the option would be there, but I thought he made it clear that it was there from the standpoint of making sure that every American had a choice and an opportunity to have insurance as opposed to a mandatory entity.
So you think public option is still on the table?
I think it is in some form.
I think Nancy Pelosi is already seeing a change there because she's come out and saying we can be flexible.
Well, she has to say that as Speaker of the House, and I think it's important that they're trying to have a bipartisan approach. But let us remember, it's not necessary to have a bipartisan bill. And if we don't get the Republican participation, then we will move forward, as we've seen in the leadership of the House, for a bill that would be Democratic, and that wouldn't be good for America.
But the voices in opposition, David, I mean, they were quite loud, and especially when they brought forth the idea of death panels for sickly elders. Has that been laid to rest? Do you think that the president was able to say, you know, it's a figment of their imagination?
The people who are saying that they're going to be death panels for sickly elders, you're never going to win those people over. They're too far off the radar, and I think that the president rightfully is writing them off. But look, something needs to be done about health care in this country. If we keep on going the way we are, Medicare is going to run out of money in 8 years. Our GDP is going to encompass such a large percentage of will be devoted to health care that we're just going to become broke.
So you raised the money issue, and that really seems to be the area where people are really concerned. It's hard to believe that a $900 billion plan isn't going to add to the deficit, and yet that's what the president's saying.
He was very specific. He said he would not sign a bill that would add to the national debt. And I think that's important. I think what's missing here is that the deficit we have, number one, is not something that he created, it's something that he inherited. He made the observation that the amount of money being spent on the war would more than pay for what we're talking about. But he also was specific in talking about Part D of the Medicare bill in terms of making some revisions there. And those revisions would offset what was done under President Bush, which brought the pharmaceuticals in and made all the changes in terms of drug purchases and acquisitions. And the president made the observation there's enough waste that's there, and $150 billion perhaps, to go a long ways in terms of paying for this bill by reallocating what we're already spending.